What is up there, beautiful people, and welcome to another edition of Just Trending News. Today we're speaking everything that's related to Dr Phopi Ramathuba. If you don't know who she is, she's a South African politician, the Limpopo MEC, and she is also a medical doctor, of course. So basically a video of her has been trending after she addressed an illegal immigrant, Zimbabwean immigrant, in a South African hospital in Limpopo, and this is basically what happened in the video.
You speak Shona, and then how do you find yourself in Villa and when you are supposed to be with Munangago there? You know he doesn't give me money to operate you guys, and I'm operating you with my limited budget.
Thank you so much. I appreciate
well, you can't appreciate that. You're killing my health system. You are killing my health system. When you guys are sick, I'm hearing these days, you just say, let's cross Limpopo River. There's an MEC there who's running charity department. It's not. And I'm going to tell you something that is truthful and painful. You know, Stats SA goes and count people during the census and tell me that in Limpopo, you have got 5.7 million people. And tell me, out of that 5.7 million, 91% do not have medical aid. They are dependent on the state. 9%, they will say, has got medical aid. They depend on private hospital. And then they go and give National Treasury. When National Treasury allocates its budget, they said Limpopo has got 5.7 million people, and they subtract the 7%, 9%, and they give me the budget of the 91 to do all these operations. Now, I am here, instead of using the budget for what it's meant for, I'm operating for what Munangagwa is supposed to do. And that is why when my people of Limpopo want health services, they can't get. And that is angering the community. Because you are coming here to, I was in George Masere. We are busy operating Mozambican national everywhere. And you are not even registered anywhere. You are not counted. You are even illegal. And you are abusing me. This is unfair. It's unfair. I can't go to Zimbabwe and get health care.
Well, there you have it, ladies and gentlemen. That is the video of Dr. Phopi Ramathuba addressing the illegal immigrants. And I must say, 100% gold star on the forehead, full marks for this doctor right here. You can tell that she's intelligent and educated. I mean, she was able to articulate the repercussions for this woman's actions in a clear way for her to understand. You know, she was able to show her that when they do consensus, the departments usually budget for the people that are there in consensus or counted for in the consensus. So if you're an illegal immigrant, that means that the budget, or you haven't been accounted for in our national budget. And that means that whenever you come to our healthcare system, obviously no one can be turned back by medical doctors because it's against the law, but it means that you're actually crippling and crumbling our healthcare system that's already crippled and crumbled. You know, it already cannot handle the South Africans that are there. Imagine if you add a whole bunch of illegal immigrants to it. And a lot of people try to put or paint this narrative of people who speak out against illegal immigrants, and they try to call and label these people as being xenophobic, and no, that's not the case. Had this person been a Zimbabwean or Nigerian or wherever else from Africa, and this person was legally in South Africa, I highly doubt that Dr. Phopi would have said what she wanted to say or what she had said to this patient. The truth of the matter is that how can you come as an illegal immigrant to a hospital in South Africa when you swam through a river that was infested with crocodiles and try to claim that you have regard and respect for your life? How does that make sense? If you're willing to risk your life that much to enter into a country illegally, how are we supposed to know that this life that we're sacrificing our national budget for is something that is precious to you? How are we supposed to know that? If it were me, if I was the MEC, and obviously if it was perfectly legal, I would have sent that lady swimming. I'm so sorry, guys. You can call me xenophobic. I know I'm not. I know my truth. You can call me whatever name in the book that you want to call me, but I would have sent that lady swimming if it were up to me. Because honestly, this is how we have people who are not able to get public health care in South Africa. It's because these illegal immigrants are straining an already strained economy, an already strained healthcare system. I don't know how many ways we must try to say this in order for it to actually sink into people's brains. 100% we're not xenophobic. Well, I am not xenophobic. If this person were a legal immigrant, she would have had no right to say what she was saying. The only reason she said that is because this person is illegal. They're in a country that they're not supposed to be in. So who's to say that we shouldn't have put her in handcuffs? Who's to say we shouldn't have put her in handcuffs instead of actually operating on her? I'm sorry, I know it sounds harsh. I know it sounds heartless, but it's just the truth of the matter. It really is just the truth of the matter. Try and travel. Go to all of these different countries, and try to get private healthcare system or healthcare system for free. Try to get any type of healthcare system for free. Oh, Zoe, you won't get it. And honestly, when we say that we're not a charity case as South Africa, people think that we're being heartless, but we're not. It's because we're already under-resourced. And yes, there is a level of resource mismanagement from our politicians. 100% there is, but that does not change the bottom line. And bottom line is, if you're illegal, you're not supposed to be in South Africa. Duh. But anyways, ladies and gentlemen, I don't want to make this video too long. Tell me what you think in the comment section, and I'll see you in my next upload. Goodbye, lovelies.